Can a military veteran's bilateral or both sides hip arthritis be service-connected as secondary to bilateral knee arthritis? I want to share my thoughts as an orthopedic surgeon in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. This is another of my videos in which I'm answering service connection questions that I get from military veterans across the country. This one, I don't have the whole question because there were a lot of parts to it, but it was basically this. I have arthritis in both knees that have been service connected. Could I claim my hip arthritis that I have in both hips as secondary to my knees? And she had gotten advice that no, that they're going to basically say that arthritis doesn't jump from joint to joint, and it's in that scenario, especially bilateral, and now both hips and both knees, it's most likely the aging process and genetics and things like that. And so I would say yes, it definitely can be argued. Bilateral knee arthritis, osteoarthritis, degenerative joint condition, progressive breakdown of the cartilage in both knees leads to pain, stiffness, reduced mobility or motion, and sometimes joint instability. It arises a lot of time from wear and tear, prior injuries. Sometimes age can play a role in that, can significantly alter the military veteran's gait and biomechanics. So from a disability claim standpoint, arguing how the knees can cause the hip issues is crucial, but because you have to establish a nexus. One caused the other. The primary knee condition led to secondary or subsequent hip degeneration, allowing you to claim it as a service-connected secondary disability. The primary mechanism linking knee arthritis to hip arthritis is compensatory changes in movement patterns, knee pain and dysfunction. Basically, especially with both knees, you develop an antalgic or altered gait, a limp, leads, and that's due to the discomfort. You end up with shorter stride length on one side, reduced knee flexion, shifting your weight unevenly during walking. That disrupts what we call the kinetic chain of the lower extremities, now placing more stress on the hips and the spine, sometimes below down to the ankles. That altered stress basically then leads to increased stress and shear forces and compression, in this case on the hips, the articular cartilage and subchondral bone, over a long period of time. Over that long period of time, that repetitive overload wears out the cartilage in the hips, leading to osteoarthritis. Again, not just that wear and tear and increased stress, but inflammatory processes and bone remodeling that progress to symptomatic arthritis. When it's bilateral, the symmetry of the knee involvement leads to symmetrical hip strain. So the bilateral does not negate the disability claim, in my opinion. Neither side can compensate for the other side. Knee arthritis has been shown to alter gait, again, with that loading adjacent joints above, below, and the opposite side of the body, and that's where it leads to the hip arthritis. You compound things like muscle weakness around the knees, quad atrophy, leads to increased stress on the pelvis and the hips. Those biomechanical imbalances lead to increased stress on the subchondral bone. Inflammation in the joint leads to osteophyte formation in the hips. Then you end up with bone spurs that narrow joint space, and then you got full-blown osteoarthritis. Then you add in potentially obesity from the knee arthritis, the prior trauma, amplifying that progression. But the causative part is that the knee injury can cause the hip injury. You'd want imaging, x-ray showing the joint space narrowing. Ideally, gait analysis can be very helpful, establishing that connection either with your doctor or doing a DBQ with an orthopedic surgeon like me. Showing that early intervention, physical therapy, medications, injections, things like that can help establish the service connection, and obviously that the hip is causing you issues. But yes, bilateral knee osteoarthritis can be a precursor to bilateral hip osteoarthritis due to the abnormal stresses, the eroded joint integrity, and all of that, and that can be argued in a secondary claim. If you want to learn more about the disability claims process, I wrote an eBook about the most common reasons the VA denies service connections. Click the link in the description below, and you can have that absolutely free. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Not Ask Dr. Geier. Well, I do that too, but Veteran Nexus Letter live once a month on usually the first Monday of the month is a ton of fun. Okay, if you're interested in a Nexus letter for your injury or condition, click that link in the description below. Scroll past the ebook. You can learn more about working with me and my team. We try to make the process simple. We try to make it as quick as we can for you, and I try really hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you.